So let's get going. This is CISN's mission. We are quite a broad mission. We really work to work with patients and all other stakeholders. We use the internet in a large way, both through information and through training, but we also are out in the community and giving trainings, etc. The curriculum developers, we've been developing the curriculum on the website for about 10 years. Every year we write a grant and we get a little bit more to add a little bit more to the website. We're very small, nonprofit, mostly volunteers and consultants. The bulk of the work is done by consultants. Here's the people who have provided that work for us. The NCI reviewed all of the material for accuracy and completeness on the research section, so you can trust that. And remember to ask questions at the end. This is designed to go all the way through, and we're not doctors, we're not providing information. We won't do it on this webinar or any of our other 11 on what to do in any given situation if you were a patient. So the learning objectives. We want this session to be available to you so that you can understand the content on our website. There's a lot of material there. There's over 400 pages. Some of it is for cancer patients. Some of it is for advocates. And surprisingly, we get an awful lot of professionals that use the material. We get emails all the time from researchers, from oncology nurses, actually even high school and college teachers saying, can we use this image, can we use that section of the website? So that's been kind of a surprise to us that other people have found us besides patients and advocates. The other purpose of the website is to help you understand how to use the trainings that are already there. All of this is free. It's been there for over a year. And then the third purpose for today's webinar is to kind of encourage you to use the website before the next webinar and the one after that and the one after that, so that every time I send out a reminder, you'll get a little kind of paragraph about what that training is going to be about. So you can go to that section of the website and read and learn and actually even download the PDF and download the same training that I'll be giving. For me, that's always been helpful. One of the frustrating things when I attend webinars is, especially if I don't understand the topic, maybe it's on precision medicine, maybe it's on immunotherapy, and then I come into the webinar and my knowledge builds as I go through it, but by the time it's over, I'm just beginning to think of the questions that I would like to ask. And so we've designed this so that you can go before the webinar and you can actually read the content, look at the talk, and familiarize yourself a little bit. If you don't want to do that, that's fine. But it's one area that has always frustrated me, that I didn't have the slides beforehand. So we're going to set it up a little bit differently for you. So here's the overview for today's session. If you look at this slide, that banner across the top, that's what our website looks like. That's the banner from our website. The scroll bar on the right is the scroll bar from our website. Those are our headings. We're going to talk about the different audiences that use our website, as well as the trainings and a bit of a summary, and then a lot of time for questions for you. And you'll want to kind of remember this toolbar a little bit. We'll go through it today. That's what our talk will be about. So let's start with the audiences. Wherever you see this little yellow arrow, we're going to drill down for that subject. We're designed to meet many needs. All cancer patients, we're not disease specific. We're a little bit different than most nonprofits in that way. We think the situations that cancer patients and their families find themselves in, the emotions, the decisions, all of those things are the same across cancer types. So we really just talk about those kind of issues. We don't talk about a specific cancer, and we don't talk about specific treatments. So that's where we're a little bit different. We also have a big section for advocates, and as I said before, medical professionals are beginning to use our site as well. So let's drill down. We said we're going to drill down wherever there's a yellow arrow. Let's talk about patient content a little bit. And the reason we're doing that is because I'm sure, just like me, you get emails all the time. Someone saying, I have a friend who just got diagnosed, someone's asking me about this. So we're going to talk just a little bit today about the patient content that's there. So if you get those kind of emails, if the organization you belong to asks you where can you go for information, you know that you can refer them back to us. All of the headings that are in white were designed specifically for patients and their families. The ones that have the yellow text, like personalized medicine, research, and advocacy, we thought when we were building the website that only advocates would go there. Well, surprisingly, lots and lots of patients go there, especially the research section. I'm guessing 70% of our hits are to that research section. So that's tens of thousands of hits every month. And I know that's not all advocates. So it turns out that people want to know about research. People want to know about cancer. So that's how that is designed. We're going to drill down again to the yellow one. These are our categories, and every one of these categories, whether it's recently diagnosed, Cancer 101, survivorship, research, advocacy, inspiration, resources, each one of those has about 20 to 30 pages built into it. So lots of information there. So let's dig down a little bit to the recently diagnosed so you can see what we're talking about. Just under that heading, here's all the subheadings under that. So lots of information on quality of care, what that means, what someone newly diagnosed needs to be looking at, how to manage their care, whether it's getting a binder, putting things together, quite a lot of information on insurance and understanding your diagnosis. All of that is in this one section. We're going to drill down again a little bit with this yellow arrow to interpreting your pathology report. And after that, we'll drill down a little bit the treatment choices. And we're doing that just because we're trying to explain what's on our site on a PowerPoint without you actually seeing the site. And that's a little bit tough. So we're doing it this way. We'll drill down to certain areas of the site just so you can see the depth of information. So one of the things we really encourage people is to get a copy of their pathology report. We have 3 or 4 pages just on the pathology report. This is an image from the site of an actual pathology report. This person is made up. The disease is made up. The information about it is made up. It was posted on someone else's site, and we got permission to use it, just so someone could see that this is what's going to be on it, what it's going to look like. Each one is a little different because every hospital can design the way they want it to be, but it'll have generally the same. So we spend quite a lot of time defining and explaining terms. We don't think most patients are going to get too deeply involved with the pathology report, but why we encourage them to have one. It became a real issue after Katrina when hospitals went underwater, and they lost not only their hard copies, but their electronic copies of everybody's records. So patients would show up to other doctors across the state, across other states, because people moved, and they would come in and they'd say, I have cancer. And the doctor would say, well, what type? What stage? What were your treatments? And people would say, I don't know. And there was all kinds of articles in the paper after that saying how shocked doctors were with the fact that people really didn't have a good grasp of what was wrong with them. And so that's why we encourage people to get a copy of their pathology report. It may be electronic. With the cloud, most of us are using that. Most of us have access to our information. If something happened to our computer, we could download it. But it's surprising how poorly set up most cancer centers and universities and hospitals are, and doctors' offices are. They're not as advanced technologically as individual people are. So they may not have access to online servers if their in-house one goes down. So it's still, even in the day of the cloud and online servers, it's still a good idea to have your pathology report. So we really do encourage that on the site here. So that's a little explanation of how deep we go into a topic. The next drill down was treatment choices, just so you can see a little bit about what we talk about. We spend a lot of time talking about standard of care, not what a specific disease would generate, but what kind of doctors you would have. When you go in for the first time, it's amazing. You have an oncologist and a radiologist and a pathologist, and there's social workers, and there's all kinds of people. You just don't have a clue what they are. So we talk about that. We talk about what the usual choices are, that you may be told that you could have surgery, chemo, neoadjuvant chemo, hormone therapy. We talk about all of that and a little bit about the risks and benefits. Here's the kind of questions you would want to ask if someone offers you this treatment. And we encourage the use of treatment plans, and that will be in all best practices that you see from the NCI or any place else, but I don't know too many people that actually get a treatment plan. It's still something that a lot of people don't get, so we at least present the subject and say, please write this down. Tell me what I'm going to do across the breadth of my treatment. We have quite a few pages on integrative, complementary, and alternative medicine. That term changes all the time, depending on what's in fashion. We explain what it is, and we also encourage people to inform their medical team about it. It's surprising that a huge majority of people use some form of alternative care, but they rarely tell their doctor, and there's cases where that's important and can countermand some of the things that are being prescribed by their oncologist. This is where we also talk about clinical trials, and we have a lot of pages about that. And it's all written in a lay language-friendly manner with lots of pictures. If you've been to our site, or as we go through the rest of the talk, you'll see that there's lots and lots of images. I'm a visual learner, and so we think people, once they're diagnosed, become visual learners because their brain isn't processing and holding information like it usually does. Even if they're an auditory learner, they become a visual learner once they're in shock. So we talk about clinical trials here because, unfortunately, if you don't know about them when you're making your treatment choice, it's usually too late. So even though I hate to refer them as a treatment choice because it is a research study, and we don't know whether it will be as good a standard of care, and we explain all of that in the section, we do present the information about them under treatment choices, just so people are aware of them and can go in to their doctor and say, you've offered me this and this. Are there any clinical trials available? So that's why we've got it there. Okay, let's move on a little bit. Here's a summary of the patient content. I said we would just talk a little bit about that because you're actually here as an advocate. This is just to inform you of the kind of things that we do offer. Remember, it's not disease specific. We have a lot on survivorship, and we're actually adding about 10 or 15 more pages this year. We got a little money to do that. We have a pretty big section on inspirational personal stories. And we're always looking for more because it's one area that people do go to. They do like to read about somebody else's journey, especially if it's an inspirational one. We won't put anything on that's too scary or depressing. So we do edit what people have submitted and ask them to, could you please rewrite this with a little less of this and a little more of that. But if you know anybody who would like to have their story online, you can go back to your organizations, and all you'd have to do is go to our website and look under inspiration heading, and there's a good explanation of how to do that. So let's talk about advocate content, because that's why you're here. That's why we're doing these webinars, is to really provide training for you. And the purpose is to increase your knowledge, plus to provide some training. So I think just increasing your core knowledge is one of our primary goals. And so that's why we have so many pages on the website for that. We didn't add trainings until a couple years ago. For 4 or 5 years, we just had the web content until we got enough grant money to start providing trainings. So every year we're taking it a step further. This year we're taking it even another step further by doing the webinars of the trainings, so that you can actually hear, instead of just reading a training and seeing a bullet point, you can actually hear more information about that. So we have two big categories for advocates. One is called the research category, and there's that heading on our toolbar there. It'll say research. The other heading is advocacy, and there will be a heading for that. Under the research category, they're all designed as free e-courses. So you read the web content, and some people stop there. That's all they do. They want to know something, and they read it, and they're fine with that. We also have an e-quiz available, though. And we have a non-graded one and a graded. They're both exactly the same questions. One is graded and one's not. The non-graded one, if you give an incorrect answer, it'll prompt you and say, please respond again. They only take about 20 minutes to do. They're about 20 questions long. We suggest you do them open book. Have one tab with the website open, the other tab with the e-quiz open. They're not there to trick you. They're just there to test key points of knowledge. And that's kind of why we encourage people taking the e-quiz. Because when you're reading web content, your mind could drift. You could be kind of thinking about this or that and miss key points. And the e-quiz will come back and center you, because we have learning objectives before each quiz, then the quiz, and then really extensive answers to the learning objectives along with the summary, so that you've got everything you really need to know about that section will be summarized if you take that e-quiz. And then we have PowerPoints that are available for you. And that's the training. That's the actual trainings that we'll be doing this year. Only 4 were newly developed this year, and those are all the tool-based ones. All the science ones are on our website already and have been for a couple years. Under the advocacy category, it's new as of last year, and we've got it divided up into overview, community advocacy, research advocacy, and toolkit items. So quite a lot there. We'll talk about each one of them in depth more as we go through. We're going to drill down with this yellow arrow to the research category, so that you can start to begin to see what we have on our site for you. So just under the research category, these are our subheadings. What we know about cancer, and another term for that is Cancer 201, how cancer is studied, and under that we have Clinical Trials 101 and Clinical Trials 201. A lot more in-depth information about clinical trials here than under the patient section. A heading called Drug Development, and that's an area that I didn't really know anything about until someone asked us to put that up. And so that was really new information for me, and more advocates are being asked to be involved in this level, so hopefully you'll find that helpful. The section, honestly, that gets the most hits is new treatments, and I'm guessing that's from patients who someone talks to them about a possible immunotherapy study or some nanotechnology that they may be prescribed, and they're looking to find out what that means, what that's about. So we get lots and lots of hits there. It's a full section. We've divided it up into targeted therapy and molecular diagnostics when it comes to the training, but the content is all under the new treatment section, and we'll drill down to all of these. On our website, we've termed it personalized medicine. That was the term that was in use a couple years ago when we put that out. Oncology has moved away from personalized medicine to precision medicine, because in oncology it's pretty much tumor biomarker generated. There is a huge movement called personalized medicine that goes across all diseases, and that incorporates not only the omics or the tumor markers, but it also includes all your other lab work. It also includes all your lifestyle practices and habits and patterns, all your environmental exposures, your value system, how you feel about this, that, or participating in decisions or compliance of care. So personalized medicine is the wave of the future. It's a term that will be heard more and more often, but in the area of oncology, it's becoming known as precision medicine. And that's a whole heading outside of the research heading, because so many patients wanted to know about that people told us, you know, we're not going to drill down into the research section, so please put that someplace else in your website. When we design things, we do focus groups, and people said, pull that out. So that section, even though it is scientific in nature, is pulled out, and lots of people access it, actual patients. So let's start drilling down into each of these, because this is the core of our work. This is what we're hoping you benefit from. So let's go into what we know about cancer. Under that heading, we have three other big headings. One called Basic Cancer Biology, one called Advances in Cancer Research, and then a whole lot on omics and what that is and what that means. And so each of these headings has 10 or 15 pages, and they all have very detailed images. We'll go through that a little more. Let's see, I've got a real skitsy mouse here. There we go. So let's drill down into basic cancer biology. As you can see by the images, they're really helpful. Sometimes if you're talking about a cell and a cell cycle or cancer genetics, a picture helps a lot. These are all the subcategories under basic biology. It's either a high school AP biology course, maybe a beginning college course. We go all the way back. This isn't meant to be something that you sit and read and memorize, but it's real tough to go to a research meeting or even to be in a clinical trial design meeting and not have the vocabulary and some basic core knowledge as part of your understanding. It would be like sending a limited speaking English person into her oncologist, and he's talking to her, and she maybe understands that every third or fourth word. And then she tries to put it together in her head. That's the kind of the way it is for us as advocates. Once we get diagnosed and we become an advocate and we go into a research setting, we don't have 10 years of science background, core knowledge as part of our understanding. And so that's what we're trying to provide here, is to give you that basic core that if you know this, you can go into any research meeting and you'll kind of get the gist of what they're talking about. For me, every time, even though I was involved with writing and editing and putting all of this on the website, every time I enter a new situation where I know I'm going to hear something on something very specific, I go back to the website and I reread it, because it's not the kind of thing you're going to memorize. But once you've read it and think about it, you can get an understanding, a basic understanding that will really help you as you go through your advocacy career. And so these are some of the headings, some of the pictures, the language of biology, what that is, what's DNA, what's RNA, what causes cancer, what's genetic variation, what does that mean. Even in our National Clinical Trial Network work, even when we go in those organized committees, they're still talking about some of the science designing that study. And so having an understanding of some of this will help even there, and absolutely it helps every place else you go. So let's move into the second research heading, how cancer is studied. This is much, much, much less detailed, much less scientific, and is basically just an explanation of what basic research is, what translational research is, what clinical research is, and that's where we're plugged in for this work. Clinical trials, how to design good clinical trials, ones that ask and answer questions that are important to patients. And then epidemiology. So we have a lot of information there, just so you understand that research process. Because just like a clinical trial development has a process, so does research. There's a process that it goes through. And for those of you that are interested in it, we've got it laid out for you there. So let's dig down to clinical trials again, because that's where we're involved mostly. We have a lot of information there. The diagram on randomization and being stratified and controls and agents, that's a very basic diagram, but we have ones that are much more in depth. We talk about ethical issues where you won't get that many other places. But we also go through all the different trial phases and the types of clinical trials. And so I think we've got a good solid core of information there for you to read. And probably all of you are familiar with this, but if you know of new advocates coming in who need this type of information, you can send them there. So this is the heading, drug development, that I think probably most of us have the least amount of knowledge about. It's in an area where more and more advocates are being asked to be involved, so we put it on the site. We've got stages of drug development, the regulatory process, economics, some stakeholders. It's really interesting information if you're involved at all in drug development as an advocate, either with the FDA, the NCI, with industry. I think this will help you. Let's drill down a little to the stages. These are terms that you probably haven't run into. What's target identification, or lead identification, or lead optimization? All of these are terms that are used. There's a process just like everything else. It moves from the beginning through the end, just like all other processes. So I think if you have any interest in drug development, you'll find this section really helpful. So here's the heading where we get the most hits, again, under new treatments. We talk about targeted therapy. We talk about angiogenesis inhibitors, immunotherapy. We're going to drill down there because that's this year's buzz word and what everybody's most excited about. We also have information on gene therapy and nanotechnology and tumor markers and molecular diagnostics. If you look at the images, you can see that when we talk about gene therapy, we not only have a lot of discussion around it, but we have a lot of images that will help you understand exactly what that is, how that happens, what the process is. For nanotechnology, the same thing. So all of these are explained in a way that you can understand them and that you can benefit from, so that you better understand what those headings are about. So let's drill down to immunotherapy, because that is what is in the news now. We have a lot of pages on immunotherapy. What it is, how it works, what's an antigen and what's an antibody. I mean, there's some core basic knowledge that you want to know if you have any hope of understanding what immunotherapy is, or helping somebody design a trial that's immunotherapy based. They're coming up now. It's going to be important that you understand a little bit about what that really means. So we have real detailed images, a detailed explanation of what's happening, what the process is, what the benefits, and a little bit about what the problems could be, areas of concern. So if you've got an interest in this, please go to this section here. I think you'll find it helpful. And here's the precision medicine heading. And again, it's pulled out of the other one. It's not under research. You'll find it at the top of our toolbar. And we've got a lot of information there. What is it? how does it affect you? We talk a real lot about tissue issues because you can't have precision medicine without tissue. And unfortunately, there's a lot of issues around collecting tissue. I'm on an NCI panel. We've been doing a research study for about 2 years now. It turns out if you get a hemoglobin, a CBC, a cholesterol value, any lab thing, it's in a CLIA lab, and it's done the same way wherever you go. Unfortunately, when tissue is collected, when tissue is processed, and when tissue is tested, it's different almost every place you go. And you end up having to, compare apples to oranges. It's not a good picture. It's not very good at all. For a lot of years, it didn't matter because it was just researchers in their lab, looking for biomarkers. Well, all of a sudden, we're to the point where those biomarkers are becoming meaningful, and people are being treated based on that. And yet, we still don't know if clamping, how long clamping is acceptable when you're in surgery. Is 10 minutes different than an hour? Is lack of oxygen to that tissue destroying a tumor marker? There's a whole lot of things we don't know yet about getting accurate biomarkers from the tissue. Once it's out of the body, how long can it sit in surgery? How long can it sit on the pathology table? How long can it be in the formalin? If that tissue goes on a Friday afternoon, it's going to sit there a lot longer than it does on a Monday morning. So there's issues that haven't been standardized yet, and it's something that as advocates, every time you're in a clinical trial and they're doing correlative science, you ask, is it a central lab? Is it a CLIA lab? Do you have standardized procedures in place? Have you looked at the NCI best practices? There's things that we can be pushing, at least at the network level, cooperative group level. Most of that's already happened. The NCI is insisting on that. We've found out the hard way that if you have site A, B, and C, and they do the same test, but they do it with their home brew, those answers don't compare to each other. If you send A to lab B, they can't match it. And it's because they're all doing their own home brew. So we talk a lot about that here. Lots of images, lots of graphs, lots of pictures, lots of core knowledge for you to take wherever you go to make sure that you're holding researchers to the best standards that are out there. And we can only go as far as we know. The research isn't in yet how long it can sit at room temperature. We don't know. How long can it be clamped? We don't know yet. And that's actually very scary, I think. We also talk quite a bit about ethics, about access and money and who should know and who should be told and when should that happen. And so those are issues that we don't have answers for, but we ask a lot of questions about that. We also have a big section on molecular diagnostics because without those, you can't get your answers. So more and more is based on the molecular diagnostics, the companion diagnostics. We talk about what that is, what some of the problems are with that, because again, it has to be validated. So lots of information. Trying to keep up with the science is tough. We're trying to help you, and so if you've got an interest in this area, please go to this section. And this is drilling down a little bit more in there. And we've talked a little bit about the biomarkers and a little bit about who will experience drug side effects. That's an important part of precision medicine. Who should get the drug? What dose should they get? Whether it's pharmacogenomics, information that needs to be known. We talk about all of that. We also talk a little bit about the need for patients to donate tissue and the issues that go around that. So there's a lot of information there for you. And it is the wave of the future. The best hope is to move forward in this area. So all of the problems that are associated with it, we just have to work out. We just have to move through it. And that'll happen with your help. So here's a summary of the research-based content It's a quick little snapshot. If you click on the research heading, and then under that there's a little tiny one that says Research Index. If you click on that, then you'll get this. This is a snapshot of what that looks like. And all you see here now is what we know about cancer. And this is how detailed we get. We talked a little bit about the basic cancer biology, but there's also a lot of information on the next one, Advances in Cancer Research. What are the hallmarks? What did they find out? Why is that important? Why do you need to know it? What's an oncogene, a tumor suppressor gene, or a DNA repair gene? What are the new research hallmarks that we found in the last, since 2000? Quite a lot of new knowledge there. So all of that is discussed there. And then we go into the omics revolution and beyond. Lots of images. What's genomics? What's proteomics? What's metabolomics? What's systems biology? Each of those things has strengths, weaknesses, problems, advantages. We have several pages on every one of them. I've heard a really sophisticated advocate giving a talk, and she didn't know that there was a difference between proteomics and genomics. Well, that's hard to know if you haven't had a course in it, or if someone hasn't laid it out for you. So we lay all of this out so that you can understand it. It's not the difference between what we're doing now and listening to a researcher give a talk is they'll talk as if you know all of this. Our talks are based on the fact that you may have some knowledge, but we're going to deepen it and broaden it. And that's where we're different. That's where our series of webinars are different. And quite a few people have said, oh, I don't need your science training. I've been doing this for quite a while. I could go to your website and I can pull down the PowerPoint training. And that's true. But what you'll get is just some bullet points on a slide, like here. You won't get a conversation of what's important, of what genomics, how it's different from proteomics. You're just going to get a slide with bullet points. So I really do encourage you to make as many of the webinars as you can, encourage your colleagues to do that. The point is to get as much new knowledge to you. And a little bit of explanation of how you can get it on your own by going to the website. So that's the summary of the research-based content. And you can see that it's just a little snapshot. There's lots and lots more there. You can go anytime. We've got a nice search button up at the top. If you're looking at nanotechnology, you type that in and you'll get all the places on the website we talk about that. So, or you can say, explain DNA to me. You'll find a whole bunch of pages where we talk about that. So go to the website, find all of the information that's of interest to you. But let's move on. Remember, the advocate content had two big categories. One was the research, and we just finished that. The advocate content is the next one, and this is new to our website. Patty Spears wrote the research section, and Sandy Feinstone wrote the community advocate section. It's information that you might find helpful, and absolutely your organizations might find helpful. Anytime you have someone who's interested in being an advocate, please send them there. It's a wonderful, wonderful section on what we do, why we do it, why it's important, different areas. Sometimes I refer researchers to it because one of the most frequently asked questions that I get is, what is an advocate? What do you do? Almost everybody assumes you're there to fundraise for their research. That goes without saying. That's almost, unfortunately, the first thing they think about. And once you tell them, well, I'm sorry, that's not really why I'm here. There are other things I can do for you, though. And so one of the things you can do is have them go to the website to see a really nicely laid out explanation of what we do, why we do it. You could use any of this information. If you give talks to your local community or to researchers or to other groups and they want to know, please feel free to go to the website. You can use the images, you can borrow those images, you can use some of the content. That's why we're giving the series of webinars, so that you know what we have, and we're very willing to share all of that with you. So let's dig deeper where all these yellow arrows are. One of the things that I've said again, if people think you're there to fundraise for them, the next thing they think is that you're an activist, a kind of a rock throwing, I'm going to make this tough for you. The term advocate, for whatever reason, has that connotation to it. If you can let them know that there are all types of advocates, and you're actually a research advocate there to support and help them develop good clinical trials. That's what our role is. I'm sure all of you have other hats, whether it's support, fundraising, political, outreach, education. We all kind of switch hats, but when we're in the research setting. So here's a nice little image of what that overview is. And we explain that a little bit for anybody that's new, and we encourage people to become advocates. So let's dig down into the community advocate section a little bit. We explain what this role is. This is the group of advocates that's closest to our patient population. They're in our towns. They're talking with people every day. They're the ones who know what the current issues and problems are. What our latest work has been last year, putting this information up on the site, and again, in giving this series of webinars, is to try to connect community advocates with research advocates. Because, you know, I started doing this in 1997, and clinical trial accrual was 2 to 3 to 5%, and almost 20 years later, it's still 2 to 3 to 5%. It's not that I don't think we've been helpful. I think we've helped in lots of different areas, but we certainly haven't increased accrual in clinical trials. And I think that's a health literacy issue. I think there's some design things that we can help with, and there's quality of the studies that are being designed. I think that's another area, but I think health literacy is something that we haven't looked at a lot. Because as patients are diagnosed, and they're afraid, and they're scared, and they're in shock, their reasoning and their ability to make decisions on information they have no clue about what it is really tough. You're asking an awful lot of somebody to process new information and say, okay, I'll go into this clinical trial. I don't know what that means. I don't understand it. I mean, my mother kind of taught me, don't sign anything you don't understand. So if I didn't understand that, I would not be signing that consent form. So what I'm hoping that this series of webinars, and that are every place I go and talk to community advocates now, I'm asking them to partner with a research advocate. And every time I talk to research advocates, I'm saying, please partner with a community advocate. Find somebody in your community. If you don't want to do it, you might do it. All of a sudden, I mean, I have resisted this for almost 20 years. And the last 2 or 3 years, I started giving talks at Rotaries and churches and wherever anybody has an opening for a 30-minute speaker, a 15-minute speaker. And people are loving it. People want it. People are scared silly of that word cancer. And if you can tell them, here's where we're going. It's becoming, research is moving us forward. We are making advances. You know, it can become a chronic disease. There will always be people that will die from it, but many, many, many more people will live and die of something else as we move further through this process. So people want to hear the message. Take it out into your community, and if you don't want to do it, find a community advocate who does, and train her. You become the trainer, and let her take it out to the community. You can use all of our materials. You can use the trainings that we have. That's one of our core hopes, is that health literacy goes up across the country, and you can be part of that. So we're encouraging you to do that. So moving to the research advocate area, Patty wrote a wonderful, wonderful, wonderful section on this, and it explains the role and what they do and why it's important, and tips for being more effective, ethical issues that come up. We're going to have some resources available soon. We're there to make the process better, but a lot of people still don't understand what we're doing. And so hopefully you can go to that section of the website and find good responses when people say, well, what's a research advocate? Hopefully you'll find some good information there to take. And please feel free to use the images. Just do a copy-paste. You could say, courtesy of CISN, we're fine with that. So let's drill down to the resources. We're building more all the time. The toolkit isn't up there yet, but if you have any tools, that will help anybody be an effective research advocate, and you're willing to share them, please send them to me. We're going to build that section of the website. We're going to put everything we can in there. We've got a glossary now. I've just finished an acronym form, and we're going to put that there. Anything else you can think of that might be helpful. We've got some links. We've got a big section on articles, just like we had inspirational articles for patients. Well, we also have articles for advocates. And let's drill down a little bit. Some are written by medical professionals. If you know somebody who wants a doctor or a researcher that you work with that wants to get information out to people, he's welcome, she's welcome to submit that to us. It can be information written by advocates. Ann Fonfa has some information up there. It can be advocate organizations. If your organization wants to say, here's what we are, here's what we do, and we'll put your link there and send people off to you, because we don't handle those kind of things. We're happy to do that. And again, we're always looking for new content. So please go to our website and you can submit anything you want. And we hope you do. So that's the content portion of our website. As you can see, we've got a lot there. But when I look at the hits, when I go through what people are looking at, it's mostly patients that are using the information. So that's why we wanted to present this particular webinar first, so that you could see what we have there and you could start reading content before we give the webinar and training, that you can actually have some core knowledge built up beforehand. So let's go to those the CISN trainings that we're going to do. This is the next 10 that we're going to do for you. And we're suggesting that you read the web content online, take the graded quiz or not. We're encouraging you to do that, but of course you don't have to. You can download the PDF if you take the non-graded. Once we have a webinar, we're going to post it on the website so people can go. And for the community trainings, if you wanted to take a training out to your community, or do a train the trainer where you train your community members to then give the training, take the graded e-quiz, and you can actually download the actual PowerPoint that can be put on an LCD. You'll actually get a trainer's manual, and every slide will have 5 or 6 talking points. So the things that I'm saying, you will have written down, so that you can, give the training the way you want. You can add and personalize it to your audience. When I do a 30-minute one, I take one of my hour ones and I just show the slides that I think you'll be most interested in. So here's the process for the trainings. Before we have unfortunately, the tool-based ones, we don't have content other than in the research section for, the research advocacy section for, but I think that would be helpful for you. Once we get to the science-based ones, then you can go to the web and start reading the content. Again, we talked a little bit about the graded quiz, why you might want to take it. It is the way adults learn. You're presented with content, then you're tested, then you document it, and then you can start teaching and using the downloadable PowerPoints. So right on our front page, it's how to go to the e-training quiz introduction, and you can find it there. So here are the trainings. We've got 10 more left. We're just about finished with the how to use the CISN website one. We've got 3 tool-based ones, and they're going to come next because you are a functioning, working advocate, and we wanted to get the tool-based ones out quickly to you. The science-based are going to come next, and you've had the schedule, so you'll see what they are. Each one of these will have a training attached to it. We have several other presenters beside myself. So here's what we have available. And let's just go to the summary. As you see, we've got a really large website with a lot of different topics that are explained for you. We're hoping that you'll refer people to it, and we're hoping that you'll use it yourself. You can send researchers to it. You can send anyone you want to it. This image on the bottom right here, bench to bedside, is an image that I use. No matter who I talk to, I use this, because if it's a researcher, I always show them, remember, you can have exquisite research. You can have a clinical trial that you're very proud of. But if you can't accrue, if you don't get patients entered in that, you're never going to get the answer. So somehow you have to design that study so that people care about it. It can't just be your needs. You have to meet patients' needs as well. If I'm talking to advocates, I always remind them, you know, we can say researchers haven't done this or that clinical trial doesn't meet that, but if people don't enroll in it, if your friends and my friends and you and I, if we don't enroll in clinical trials, we're not going to get the answer. We're in this together. The community, the patients, the advocates, the researchers, we're all in that process together. So that image is one that you can use wherever you go to get people to understand that the needs of everybody has to be met when this process is in place. Not just the research needs, not just the patient needs. We all have to realize that we're part of this community together of getting better treatments. So that's an image that, again, you're free to use. So we've got some disclaimers. They're just all legal in nature, and they're here, but I don't need to go through them. So thank you so much for being a part of this webinar. Thank you for attending. Especially thank you to Patty for helping all the way through advice and assistance and help in every direction. Our funders for the webinar was Genentech and Novartis. The web content was lots of other people, Pfizer and Lilly and Genomic Health and AstraZeneca and a whole bunch of people. But the webinar was funded by Genentech and Novartis. So here's our website. If you want any information, this is the place to go.